Hello everyone. This presentation is on Suan Zao Ren Tang, also called sour jujube decoction. It appears on the California Acupuncture Board Examination Herbal Formula list. I will review its traditional pattern, a short hypothetical patient case, 3 potential drug-herb interactions, and a practical management plan. The purpose is educational. Herbal formulas are selected by pattern, but medication safety still requires attention to pharmacology, dose, duration, and the individual patient. Traditionally, Suan Zao Ren Tang is classified under Kamba spirit. A representative pattern is liver blood deficiency with deficiency heat causing insomnia, irritability and night sweating. Important ingredients include Suan Zao Ren, Fu Ling, Chuanshan, Jai Mu, Gan Kao. The key clinical idea is pattern matching. A formula can be appropriate for one patient and inappropriate for another patient with the same biomedical diagnosis. Before treatment, I would also screen for red flags, confirm that urgent biomedical evaluation is not being delayed, and review the exact medication and supplement list. My hypothetical patient is 48-year-old woman with insomnia and anxiety. The current medicines are zolpidem, sertraline, aspirin. This case gives a plausible reason to consider Suan Zao Ren Tang, but it also creates interaction questions. I would document the tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about allergies, pregnancy status when relevant, kidney and liver disease, bleeding history, and use of over-the-counter products. Medication reconciliation is essential because many interaction risks come from the combined physiologic effect rather than from one single herb. Interaction 1 is Suan Zao Ren plus zolpidem. The mechanism is jujube seed has sedative effects and may add to prescription hypnotics. The clinical significance is moderate because excessive sedation can impair driving and increase fall risk. My management plan is avoid taking with alcohol. Start conservatively and assess next day sedation. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 2 is Chuanshan plus aspirin. The mechanism is Chuanshan has antiplatelet activity that may increase bleeding tendency. The clinical significance is low to moderate with low-dose aspirin. My management plan is monitor bruising and bleeding. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. Interaction 3 is Gan Kao plus electrolyte-sensitive drugs. The mechanism is licorice can lower potassium and raise blood pressure. The clinical significance is low in short use, higher with diuretics or cardiac disease. My management plan is avoid extra licorice and monitor high-risk patients. I would explain to the patient that evidence quality differs across herbal products and interactions. Therefore, the safest approach is to use a known product, avoid unnecessary overlapping supplements, and pay special attention to medicines with a narrow therapeutic index. In conclusion, Suan Zao Ren Tang may be reasonable when the patient's presentation matches liver blood deficiency with deficiency heat causing insomnia, irritability and night sweating. The main safety principle is not simply to label herbs as safe or unsafe. Risk depends on the specific herb, preparation, dose, treatment duration, the patient's organ function, and the drugs being taken. I would use a reputable product, start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is for education and does not replace individualized medical care. Key references include the California Acupuncture Board Examination Formula list, standard Chinese herbal formula texts, such as Bensky and colleagues, Chen and Chen's Pharmacology and Applications text, and evidence-based drug and herb interaction resources. Thank you.